Hi, I'm Dr. Roadhouse, and I want to introduce my patient, Mary Ann. Want to tell us about, well, first of all, you can tell us your name and what you do for a living.
Okay, my name's Mary Ann, and I am an instructor in nursing at OU Schusterman campus, and I'd like to share with you the experience that I had when I sustained a motor vehicle accident in 2005.
Okay, so why don't you tell us about some of the symptoms that you had before you came in,
Okay.
and also, did all those symptoms start right after the accident? And then you can kind of tell us about all the doctors you went to.
Okay.
Okay?
Right. Basically, I started to have symptoms immediately after the car wreck. It was a whiplash injury, and I went to a minor emergency center, and they just did an x-ray and gave me some anti-inflammatory drugs and painkillers.
Okay, so obviously you went there, so what were the symptoms you had at that time?
At that point in
Yeah.
time, it was just muscle pain, soreness, and then it got worse in the evening.
Okay, but no neurological signs or
No.
anything like that? No visual changes
No,
or anything?
no symptoms
Okay,
like
right.
that.
So, and they gave you muscle laxation and okay, so then you took those for a while and
Right,
tell us.
right.
What happened.
Well, I took those for a while, and I just felt like I kept getting worse. And then that same month, it was about, 2 weeks later, I had a procedure done, and after that procedure, then I started to have dizziness and tingling, prickly feelings in my arms, and I thought, well, this is something wrong. And at that point in time, I was just so dizzy that I couldn't even drive, that I had to ask my best friend to take me to the emergency room. So at that point in time, I saw the ER doctor, and he really couldn't tell me anything other than he thought maybe it was a virus in my inner ear.
Okay, which should last for a couple of days, as
Yeah,
you know, with your
yeah,
training.
right.
So how long did it last?
Oh gosh, it never resolved.
Okay, and that's one of the reasons when you came in.
Right,
Okay, all right,
right.
okay, we'll go back to that then. Okay, so then you went there, they really couldn't figure, so now you have all this dizziness along
Right,
with the neck pain.
right.
And so did your symptoms with the neck and stuff, did they start to increase over time?
Yes, they
Okay,
really did.
all
They
right.
started to increase over time. I was never getting any better, so I went to my primary care doctor, and he checked me over, and he did an MRI.
Okay,
And that's when the MRI revealed a bulging disc,
okay,
C4-5 level approximately.
all right. So then at that point, what did he say you should do? Did he do cortisone, physical therapy?
Physical therapy.
Okay, all right. How long did you do that for?
I did 2 rounds of physical therapy.
Okay, all right, so 2 prescriptions. A year prescription?
Right,
You weren't any
right.
better, or were you
Right.
better?
I got
Did you get some relief from it?
some relief.
Okay, all right.
Some relief. It felt good, but it never resolved.
Okay, so did it feel good, like, at the time, you know, and then, like, the next day it was still giving trouble, or did it last for 2 or 3 days, or?
No, it made me feel better at the time. I had physical therapy. I could do more activities. I
Mhm.
started to resume house cleaning and those kind of activities. But it was just never got better.
Okay, all right. So then, this goes on for about, you were starting to resume your activities,
Right,
and then
right.
what happened?
I got better enough to start resuming some activities,
Okay.
but I still had the pain, I still had the dizziness,
Okay.
and I would take over-the-counter meclizine for that. And so I then thought, well, I'll go to an ear, nose, and throat doctor, see if I have any problems with my inner ear.
Okay.
And it was all normal.
Okay, all right.
And then to a neurosurgeon, and he said that I wasn't a candidate for surgery, which
Okay.
I felt good about. It was the main thing. But I
Sure,
still
yeah.
was having problems. No one could tell me what the dizziness was about.
Okay, all right. Okay, so then at that point, is that all the doctors? There's about 4
Yeah,
or 5,
there were about
right?
4 doctors,
Okay, all right,
yeah.
okay. So at that point, then, you just.
Well, then at that point, and they had told me that I would start to feel better after 2 to 3 years. Well, time wore on,
Yeah.
and finally finally, it was 2011, and my best friend Betty had taken her doctor, elderly father, to you, and I guess you had a consult with her.
Yeah, he's like
He was 90. Well, he's 95 now. At that time.
Right, he was around 93 or something.
Or something like that.
And yeah, and his medical doctor referred him over here for decompression.
Right.
But he wasn't a candidate.
He wasn't a candidate.
We couldn't do it because of his
fracture.
osteoporosis.
Yeah. So then I talked to Betty shortly thereafter, my friend, and she said, "Why don't you try spinal decompression?" And I thought, well, I had gotten so frustrated, and it was 6 years later, and I thought, I've got to do something. And so that's when I went to you and described and had you gave me a thorough neurological testing, and no one could put the pieces together of what the dizziness was about, the neck, the bulging disc, and then you had told me that, well, let's do another MRI just in case.
Because it had been 6 years.
It had been 6 years, and I could understand that. And at that time, I had no idea that it could involve more discs. And so that's when you discovered 2 bulging discs.
Right. So then we did the MRI again. Right. The one that was bulging was still bulging. Then you had the one. Right. Yeah. Okay. So then we did from the neurological testing we found a cerebellum, and that has a lot to do with the dizziness. So we started doing the spinal decompression on you with the oxygen and all the neurological testing and stuff. And it's been how many months now?
Oh my, since January.
Yeah.
And
so this is 6-7 months. Actually, it's August. So I don't know when you started in January, but anyway.
Yeah, I don't know.
And so you've just pretty much had continued improvement with everything.
Right. Steady
but the
improvement.
bonus that you came in for, you came in for the neck and the numbness and the prickly feeling and all that stuff, and the limited range of motion, the spasm.
Right.
But you didn't even know when you came in about the dizziness.
I had no clue about the cerebellum.
Yeah. So anyway, you did in school.
Well,
you didn't know what it did and stuff.
Yeah, exactly.
How it could affect that.
Yeah.
All right. So then we did the testing and we started doing that. So why don't you just tell about your progress here over the last 7-8 months?
Oh yeah, I feel like all the therapies have been a benefit to me. I haven't had the dizziness in some time. I don't have the sensations of my arms anymore.
What about
feel a
the
lot
spasms and your range of motion?
That's improving.
Okay, all right.
Every once in a while, if I still overdo it, like I did the other day on the machine, I have some spasms.
Yeah.
But generally, I've had steady improvement.
Yeah, and the one thing that you noted was that when you did overdo it, that in the past that would have been like that for weeks and months, and now one of the signs is you're feeling great, but when you do too much, and what she's talking about the machine was that we've pretty much taken care of the disc. We got a little bit to do on that last disc that we're working on because we treated the one, then we moved on this. So the machine she's talking about is the rehab machine, the ATM2.
Right.
And
that I just started.
And you just started on that. So what we were saying is that she got a little aggressive and wanted to do too much, and it's just like a gentle.
Yeah, and I didn't realize that.
Yeah, but I mean, it was sore, and then the next day you're
doing
good.
I rebound a lot faster because before, oh my, I'd be taking leave and painkillers throughout. And so
what about sleeping? How's your sleeping?
Oh, sleeping is fine.
Okay, good. So that's really improved.
That's really improved.
Okay.
Yeah.
All right. Anything else? That's enough.
Is that enough? Yeah, I think I hit it all.
Yeah, I think you've done great. Well, I appreciate it. I know that, from your medical background and all the other doctors you went to and stuff, and I'm just glad that you're open to this because this is what's changed your life.
It really has.
And I know the treatment's not covered by insurance and it's expensive, but
but I was willing to do that because I wasn't getting
and nothing else. So at that point, it was worth it to you.
It was worth it to me.
And now
it's, I think the benefit has been well worth it.
Okay, all right. Well, thank you, and we'll finish up with the rehab, but you're doing fantastic. I appreciate you sharing with
Sure, thank you.
Thank you.